A sugar pill with no active ingredients has been shown to reduce real pain, lower real blood pressure, and accelerate real healing. Your brain is more powerful than medicine wants you to think. Imagine a doctor hands you a pill. You take it, and within an hour your headache starts to ease, your anxiety drops, and your body genuinely feels different. Now imagine the pill was made of sugar. No chemicals, no active ingredients whatsoever. Just your doctor's confidence that it would help and your expectation that it would work. This isn't a thought experiment. It's one of the most documented phenomena in medical history. And the implications go far beyond medicine into how your brain creates and erases physical experience in real time. The word placebo comes from Latin. It means, "I shall please." A placebo is any treatment, pill, injection, procedure that has no active therapeutic ingredient but produces a real physiological response because the patient believes it will. The effect became impossible to ignore after anesthesiologist Henry Beecher published a landmark paper in 1955 called The Powerful Placebo. Beecher had been treating wounded soldiers in World War II when morphine ran short. In desperation, nurses gave some soldiers saline injections, salt water, while telling them it was morphine. A significant number of them reported reduced pain and were calm enough to undergo surgery. Back in the lab, Beecher analyzed 15 clinical studies and found that roughly 35%, over 1 in 3, of patients showed meaningful improvement from treatments that contained no active medicine. That number held across pain, anxiety, and several other conditions. He called it the powerful placebo and forced medicine to take it seriously. The placebo effect isn't imagination. It isn't wishful thinking. It produces measurable physical changes in the body. In studies of Parkinson's disease patients, placebos triggered the actual release of dopamine, the neurotransmitter that Parkinson's destroys. Brain scans showed the dopamine. The pill was fake. The dopamine was real. In pain research, placebo painkillers trigger the release of endogenous opioids, the brain's own natural pain-relieving chemicals, the same system that real opioids target. When researchers gave patients a drug that blocks opioid receptors, the placebo stopped working, proving that the placebo effect was operating through the same neurochemical pathway as actual opioids. Your brain, given the right expectation in the right context, can produce its own medicine. The signal from your mind to your body is real enough to change what that body does. Here's where it gets genuinely weird. In the 2010s, a series of studies at Harvard and other institutions tested something called open-label placebos, where researchers told participants explicitly, "This is a sugar pill with no active ingredient. We're giving it to you anyway." They still worked. Patients with irritable bowel syndrome who were told exactly what they were receiving, a placebo, still showed significant improvement compared to no treatment. Patients with chronic lower back pain who knew they were taking placebos reported meaningful pain reduction. The ritual of taking medicine, the pill, the glass of water, the act of treatment, was itself triggering a physiological response. The brain's expectation of healing, activated by the ceremony of healthcare, produced real effects even when the deception was removed. This suggests the placebo effect isn't just about lying to patients. It's about the power of context, ritual, and expectation over physical experience. And if that's true, if knowing it's fake doesn't fully stop it, then something very fundamental is happening between mind and body that medicine is still only beginning to map. This isn't a reason to avoid real medicine. Placebos don't cure cancer. They don't regenerate torn ligaments. There are hard limits to what expectation alone can produce. But within those limits, particularly in pain perception, mood, and certain physical symptoms, the research is clear. The way you frame your experience physically changes it. This has real, practical implications. Patients who are told a procedure will be effective recover faster than those who are given the same procedure with neutral messaging. Athletes who believe a supplement works perform better even on sugar pills. Students who are told they slept well regardless of how much they actually slept, perform measurably better on cognitive tests. Expectation is not a soft, psychological phenomenon. It is a biological variable that produces biological outcomes. The brain is not a passive passenger in the body. It is an active participant in what that body does next. What the placebo effect tells you is that your interpretation of what's happening to you has physical consequences, not metaphorical ones, real, measurable, chemical ones. The story you tell yourself about your own healing, capacity, and resilience is not separate from the biology. It participates in it. That doesn't mean thinking happy thoughts cures disease, but it does mean that the relationship between your mind and your body is more collaborative than most of us were ever taught. Drop a comment. Have you ever felt a real physical effect from something that turned out to be nothing? I genuinely want to know. And subscribe. New Psychology Breakdown every week.